please subscribe and don't forget to press the bell icon to get notified whenever we upload a new video.
The government today came out with draft rules to regulate hospital profit margins in the national capital. Private hospitals will be asked to prescribe drugs under the national list of essential medicines on a priority basis. Also proposes capping the profits on margins on medicines and consumables at private hospitals at 50%. Now, the government has put these draft rules in the public domain, seeking stakeholder views over a period of 30 days. Shireen spoke to Ashish Khaitan of the Aam Aadmi Party, Shailja Chandra, former Chief Secretary of the Delhi government, and B.S. Ajay Kumar of Healthcare Global earlier. She started by asking Ashish Khaitan on how the government will take the rules forward post the stakeholders' comments.
The advisory itself has mentioned that perhaps some rules framed under the Delhi Clinical Establishment Act may need to be amended, or certain new rules need to be added. But I'll tell you from the past experience of the Delhi government with regard to its interaction and interface with private hospitals in Delhi is that invariably all the advisories issued by Delhi government have been more or less complied by private establishments because of the reasonable nature and the democratic fashion in which these advisories had been issued in the past. So I don't see any reason why this particular advisory, after due consultation, whatever shape it takes, will face any pushback. And the idea is not to, wield a stick. The idea is to evolve a standard to which everybody willfully complies.
Okay, I think that would be music to the ears of the healthcare services community. But let me get in the former Chief Secretary of the Delhi government, Shailja Chandra, in as well. Ms. Chandra, we've often on CNBC TV18 in conversations with you spoken about the need for greater transparency as well as standardization. The advisory that the Delhi government has put out, A, do you believe that this adequately addresses some of those concerns? And B, do you believe that, as Ashish Khaitan is pointing out, this is not the government acting with a heavy hand. This is the government trying to get healthcare service providers to bring in a higher degree of transparency and standardization for the benefit of patients.
Shireen, what I have heard, because I have not had much access to the exact notification, but all I can say is that it is well intentioned to be able to contain the kind of profiteering and commercialization. However, health is an industry right now. If it is an industry, it has to be regulated under a statute. The Delhi Nursing Homes Act 1953 is an outdated, toothless piece of legislation. The Clinical Establishments Act has not been adopted in Delhi. If they adopt the Clinical Establishments Act, even then, on the question of pricing and on the question of containment of price, you need the Act to give you that power. Neither does the Nursing Homes Act have it, and the Clinical Establishment Act, even if it comes in Delhi, does not have that power. If that power is not with the Act, the rule-making authority cannot assume any power. So I would say a very well-intentioned idea of containing profiteering and commercialization, but ultimately goodwill alone will not work. This is a commercial business, and if people find that there is no regulation which has teeth, and there are no people who are going to be, taken to task for not doing what they are asked to do, then it is just like, good wishes and please do this, which some people, yes, Mr. Khaitan is right. At times when government issues guidelines and advisories, they are taken seriously, but only up to a point. When it comes to hard brass tacks of commercialization, ultimately the market takes over.
B.S. Ajay Kumar, I want to talk about some of the specifics and ask you what this is actually going to mean operationally as far as healthcare service providers are concerned. Some of the highlights of the advisory, the national list of essential medicines, you will have to prescribe drugs from the NLEM, a maximum of 50% of the markup on medicines. That is what the advisory says will be allowed. Private hospitals can give high-risk packages. You will have to put a cap on the packages that are provided to patients. I mean, as I pointed out, these are just some of the highlights of what the government has put out this evening. What do you make of it, and operationally, what is it going to mean for you?
See, these are all what they're trying to do in my view, they are not focusing on the type of quality and outcomes. As a doctor, apart from running hospitals, I can tell you the focus should be on the outcomes and not cheap medicine. And the reason we are discussing all this today, the price, somebody saying profiteering. First of all, where is the profiteering when the return on investment is only 6%? I think they're all totally misguided statements. All I want to say is, as long as it is majority of paying patients are cash out of pocket, this debate will go on. And as you put price controls, it will severely interfere with the quality of treatment. We will go for cheap quality treatment. India has advanced greatly. A value-based player, outcome is great. We are actually lowest in the world in terms of technology and service we provide. But if you interfere with this, we will go back in decades where we provide cheap care. And everybody will adjust to that. We don't really, private equity will not come into healthcare. Why will they come? They want the returns. India has advanced so much because of investments. Global investors see it, and the investments are what driving. Government is not driving. So no, like HCG Group, we don't have 1 rupee grant from government, not a single piece of land, an inch of land from the government. So why should government interfere? They should monitor.
Let me get a quick comment in from Ashish Khaitan. Ashish, monitor by all means, don't intervene and don't interfere, because you are going to in fact set the private healthcare industry, which you yourself acknowledged is providing a service and a much needed service to bridge the healthcare deficit in the country. You're doing that a disservice by bringing in price controls and price caps.
Let the insurance take care of it.
I think
provide insurance to everyone.
Yeah, let me get him to respond, Mr. Ajay Kumar.
I think there are several issues have been raised here, and I think if you examine each of them very carefully, you will find that they are without any basis or logic. Number one, we are not interfering or intervening at all, and when we say that all pricing should be reasonable, when we say that drugs prescribed outside the national list of essential medicines should be capped at 50% profit of the procurement cost, I think that's a very reasonable return. It's not 6%.
I want to reply to that.
And that applies to implants. Can I, Mr. Kumar, can I?
No, that particular issue, can I talk?
I'll just get you to respond. I'll get you to respond. One second, sir. 1 second, sir. Let him finish, and then Mr. Ajay Kumar. Mr. Ajay Kumar, let him finish, and then I'll get you to respond. Ashish, go ahead.
I think, Mr. Kumar, you should not get worked up. You should just listen very carefully. I didn't intervene when you were speaking.
Repeatedly told question. Yeah. I want to give a fair answer.
So implants.
Yes, go ahead, Ashish.
Medicines, all should be priced at 50%. The cap is 50%, and I think which is a very reasonable cap. 50% is a sufficient margin. Right now it was completely left open. So there have been reports, and these are reports by institutions. National, I think, Pharmaceutical Pricing Association, they have come out with a report which says that in some cases they found that the profit was at 1700%. These are all tabulated, recorded, empirical reports. So one. Number two is that when packages are offered to patients, sometimes the patients don't know that what are the hidden costs built in those packages. We just want that all those packages should be discussed threadbare with the patient, and there should not be any hidden costs. And two, if there are any risk premium which is also part of the package, if there are additional complications, then pricing should be according to certain set standards, which should be globally acceptable and globally enforceable and globally practiced right now. And the second point, which is that this will discourage private investment or global investment or foreign investment, I think that's not right. If foreign investment or private investment is coming into medical health care for making reasonable profit, then I think nobody should be discouraged. And that's certainly not the intention of the government, to discourage any private investment. All we want is transparency
well, the question
and some set standards, and everybody adheres to those standards.
Okay. Mr. Ajay Kumar, quick final say. We're completely out of time. Very quickly, sir.
You are looking in isolation for the drugs. For example, somebody has a big center in the heart of the city. When we have multiple centers, we do global purchase. So we may be purchasing at a lower price compared to somebody who's running a small hospital. Why should we be compared? Our operating costs are high. See, what we are not looking at is what is our operating cost? What is the rental cost? What are these costs to do? See, you're looking in isolation of a pharma, but look at the entire cost. How many people have employed? How many talented doctors we have? What is the price we pay for the doctors? Some of the doctors are running 200 something in crores to bring in talent from abroad to provide that quality. What does it take? That is why our return on investment is only 6%. Please read the EY report showing very clearly hospitals' return on investment is very low. Why is it so low then? If they're making so much profit and taking boatloads of money, where is this boatloads of money going? Look here, we are all accountable. We are all audited by Big Four. You please see what is our margin. Nobody has a margin more than 5, 8%, 9% in the industry. This is a question of survival. No private institution, I will give you one advice, no private institution will survive with these kind of measures of price cap. Please go for insurance. Make sure everybody is insured. What does it matter how I negotiate with the farmer?
Mr. Ajay Kumar, you've certainly started the public commentary process today by providing your comments here to Ashish Khaitan live on television, and I can imagine that this process will continue. But gentlemen, we're unfortunately completely out of time. We'll bring you back again to take this conversation forward. But for this evening, appreciate you joining us here on CNBC TV18. Ashish Khaitan, Shailaja Chandra, and BS Ajay Kumar. Thanks very much indeed.